Hormones, the unsung heroes of our bodies or silent saboteurs of our health. Today we're diving into the controversial world of hormone restoration therapy, where science meets skepticism and the fountain of youth might just be hiding in our own endocrine systems.
Wow, that's quite an opening statement. What exactly do you mean by hormone restoration therapy?
Well, it's all about bringing our hormone levels back to what they were when we were younger. You see, as we age, our hormone levels naturally decline. This can lead to all sorts of issues: fatigue, depression, weight gain, you name it. But here's the kicker: some doctors argue that this decline isn't just a natural part of aging we have to accept, but something we can and should address.
Hmm, that's interesting. So it's not just about feeling young, but potentially improving our overall health?
Exactly. Hormones are like the body's chemical messengers. They control everything from our metabolism to our mood. When they're out of whack, it can have far reaching consequences. For example, did you know that estrogen deficiency in women isn't just about hot flashes? It's associated with increased risk of heart disease, osteoporosis, and even Alzheimer's disease.
Oh, wow, I had no idea the effects were so wide ranging. So does that mean all women should be on estrogen replacement after menopause?
It's not quite that simple. While estrogen has many benefits, it can also increase the risk of certain cancers if it's not balanced properly with another hormone, progesterone. In fact, some research suggests that it's not estrogen alone, but estrogen dominance, too much estrogen relative to progesterone, that increases cancer risk.
That's fascinating. It really highlights how complex our hormonal systems are. What about for men? Do they experience similar hormonal changes as they age?
Absolutely. Men experience what's often called andropause, a gradual decline in testosterone as they age. This can lead to issues like fatigue, muscle loss, and cognitive decline. And here's something that might surprise you. Contrary to popular belief, recent research suggests that low testosterone levels might actually be associated with more aggressive prostate cancers.
So, if we had only known the importance of balanced hormones earlier, we might have been able to prevent some of these age related health issues?
That's exactly what many proponents of hormone restoration therapy argue. But here's where it gets controversial. The medical establishment is divided on this issue. Many doctors still view hormone decline as a natural and therefore acceptable part of aging.
Well, that raises an important question. How can someone differentiate between normal aging and a hormone deficiency that needs treatment?
That's a great question. Some common symptoms of hormone deficiencies include fatigue, depression, weight gain, loss of muscle mass, decreased libido, and cognitive issues like brain fog or memory problems. But here's the tricky part: many of these symptoms are often dismissed as just normal aging. The key is proper testing. And I mean proper testing.
What do you mean by proper testing? Aren't all medical tests reliable?
Well, you'd think so, right? But here's the thing: many conventional hormone tests use reference ranges that are too broad to catch deficiencies that are actually causing symptoms. For example, a normal testosterone level for a 70-year-old man is much lower than what would be normal for a 30-year-old. But that doesn't mean it's optimal.
Oh, okay. I had no idea there was such a difference. So, what should people look for in a doctor if they're concerned about hormone deficiencies?
Look for someone who's willing to look beyond just TSH for thyroid issues, or who understands the importance of free testosterone levels, not just total testosterone. A good doctor in this field will also consider the balance between different hormones, not just individual levels. They should also be open to discussing both synthetic and bioidentical hormone options.
You mentioned bioidentical hormones. Can you explain what those are and how they differ from synthetic hormones?
Sure thing. Bioidentical hormones have the exact same molecular structure as the hormones our bodies produce naturally. Synthetic hormones, on the other hand, are chemically altered versions. The idea is that because bioidentical hormones are structurally identical, our bodies can process them more naturally, potentially leading to fewer side effects.
That makes sense. So, why isn't everyone using bioidentical hormones if they're so similar to what our bodies naturally produce?
Ah, now we're getting to the heart of the controversy. You see, bioidentical hormones can't be patented because they're naturally occurring molecules. This means pharmaceutical companies can't make as much profit from them. And since pharmaceutical companies fund a lot of medical research and education, this has a big impact on what doctors learn about and prescribe.
Wow, that's pretty eye opening. It really highlights how much our healthcare system is influenced by profit motives.
Exactly. It's a perfect example of how money can influence medical practice. But here's something to consider. Despite the lack of big pharma backing, more and more doctors are starting to recognize the potential benefits of bioidentical hormone therapy. In fact, a study published in the journal Menopause found that 41% of women using hormone therapy were using bioidentical hormones.
That's a significant number. It seems like patients are really driving this change. What kind of benefits are people seeing from hormone restoration therapy?
Well, many people report increased energy, improved mood, better cognitive function, and even reversal of some age related health issues. For example, proper estrogen and testosterone levels can help maintain bone density, reducing the risk of osteoporosis. Balanced hormones can also improve insulin sensitivity, potentially reducing the risk of diabetes.
Those sound like some significant benefits. Are there any potential risks or side effects people should be aware of?
Absolutely. As with any medical treatment, there can be risks. For example, if estrogen is given without proper progesterone balance, it could potentially increase the risk of certain cancers. Testosterone therapy, if not monitored properly, could lead to an increase in red blood cell production, which might increase the risk of blood clots in some people. That's why it's so important to work with a knowledgeable practitioner who can monitor your levels and adjust treatment as needed.
It's clear that this is a complex field with a lot of nuances. What do you think the future holds for hormone restoration therapy?
I think we're going to see a shift towards more personalized approaches. As we learn more about genetics and how different people metabolize hormones, we'll be able to tailor treatments more precisely. We're also likely to see more research into bioidentical hormones, which could lead to wider acceptance in mainstream medicine.
That's exciting to think about. Before we wrap up, are there any final thoughts you'd like to share with our listeners?
I think the key takeaway is that aging doesn't have to mean accepting declining health and quality of life. Our hormones play a crucial role in our overall well being, and maintaining optimal levels can have far reaching benefits. But, and this is important, it's crucial to approach this with knowledge and under proper medical supervision. Remember, everyone's hormonal needs are unique, so what works for one person may not work for another.
Well, thank you for shedding light on this complex but important topic. I'm sure our listeners will have a lot to discuss with their healthcare providers.
It's been my pleasure. And remember, while hormone restoration can be incredibly beneficial, it's just one piece of the health puzzle. A healthy diet, regular exercise, stress management, and good sleep habits are all crucial for optimal health as we age. Hormone restoration should be seen as part of a holistic approach to health and wellness.
That's a great point to end on. Thank you again for this enlightening discussion.
And thank you for your insightful questions. I hope our listeners found this information helpful and empowering. Remember, knowledge is power when it comes to your health. Don't be afraid to ask questions and seek out information from reputable sources. The future of medicine is personalized, and understanding your own body and its needs